Okay, so another area that's worth looking at for clients or yourself if you've got chronic lower back pain is looking at how tight you are in your thighs and your quad muscles and hip flexors. Because the way those muscles function is that when they're very tight or they're locked, they tend to kind of pull your body forward on the hips, so then your lower back's got to try and pull you up. So what we're trying to do is, if you have a chronic lower back pain, is we're trying to make life as easy as possible for your lower back, so it's not kind of working all the time and kind of strain. So with a roller, what we can do is we can look at loosening these thighs. The kind of ways you can do it. Probably the easiest way to start is to do both legs at the same time. And what I'm going to do is I'm going to start off kind of up on my hips, and I'm just going to gently roll down. And what I'm looking for, I'm kind of scouring the muscle for any sudden sore spots I get. You may have got like 3 or 4, but the key is to kind of find the worst one. And then once you find it, what we need to do is keep the pressure on, and then we need to encourage some movement through that muscle to try and get those muscle knots and adhesions to start kind of loosening up. So easy way to do that is just put your heels up towards your bum. These are what I call pull-throughs. I'm just being gentle, about a second in each direction. And you want to do at least 20. But the key is with anytime you're using a front roller or doing mobility drills or soft tissue work, you should want to keep going until you at least start to feel the benefit. If you come in here and just do kind of like 3 or 4 kind of half-assed, of course it's not going to do anything for you. So your mind's going to be on what you're doing, and you're going to make sure that you do start to feel that it's going to get a little bit looser. Maybe you do one area and you find another bit lower down. You do that area as well. What we can also do as well, depending on which parts of your thighs are tighter, we also do one leg at a time. We can come in, and this is really good if you tend to be tight on kind of the exterior portion, kind of the outer portion of your leg, right in there. You can kind of tilt in and kind of get slightly different angles. You can also roll in more towards the inside as well. Again, same idea. We do like 20 pull-throughs on the worst bits that you find. And again, as always, you've got to make sure that you feel the benefit and you do actually work on your tightest spots. And if you've never done it before, you've got a hard roller, it will be horrific, it will feel horrendous, you can sway it on the bone almost. But if you keep at it every day, a little bit every day, it'll be amazing after 7 days how quickly that will start to loosen out and how looser your lower back will start to feel. Because one of the problems you get with back pain, when it does start to flare up, is that the nerves that actually feed these muscles kind of start to ball up the muscle and make them very, very tight. So if we can get these flexible, either through the recovery position or by rolling them, you're going to take off loads of pressure off your lower back. You're going to feel the benefit pretty quickly from it. It's definitely worth doing at least 5 minutes a day or so on a roller and get these tight muscles mobile.